Hi everyone. Today we're going to talk about how to treat Candida infections the most natural way possible. I'm Dr. Cam and you're listening to Camille's Holistic Health Show. If you're interested in this video or any other videos on my channel, go ahead and hit that bell, get notified, and that red button to subscribe to my YouTube channel and get notified every time I have a new video coming out. So let's begin about Candida infections. Candida is a type of fungus which grows in our body, and these infections happen when Candida grows too much in the body system. The body's bacteria in our body systems, different types of body systems, the yeast infections grow there naturally. And however, when you consume medications or any types of if you're immune compromised, then the bacteria grows, or the yeast grows at a very uncontrolled way, and it grows out of control. So the yeast infections often affect women between the age of 16 to 35. Symptoms are often burning, during urination, itching and irritation in that area, and that discharge in that area as well. Anything that changes the acidity in the vaginal area and kills the good bacteria can encourage the yeast to grow at a faster rate. Some of these causes are lack of sleep, stress, um, steroid hormone medications, estrogen replacement therapy, an immune compromised individual, someone with diabetes, oral contraceptions, birth control, and high intake of sugar and starchy foods. Okay, just to name a few. Now, a simple way to help treat Candida infections naturally is boric acid. And boric acid cures up to 98% of women's vaginal yeast infections on a regular basis. And if it's something interest to you, then get your advice from your physician. This can be used as a suppository, and 600 milligrams is usually what can be used. Standard yeast infections can be treated with 1 capsule for twice a week for 6 months to a year. And you can also use K-jelly, a lubricant that helps restore the pH of our body, the balance of our body. And the infection may go away up to after 24 hours, depending upon the severity of your infection. Oregano oil is also really excellent because it's very potent against yeast, and it could be taken as drops or liquid, and it could be taken internally. Just use the follow directions on the bottle. And yogurt, as we know, but make sure that is a cultured, active culture that contains Lactobacillus acidophilus. Now, if you are having reoccurrence of yeast infections, it's often important to know not to, avoid douching, because that really changes your balance or the pH in your body, and prevent bubble baths, wearing tight clothing in that area, avoid perfumes and different feminine deodorants, harsh cleaners, and hygiene products that can really irritate that area and change the pH of your reproductive system. Okay, so don't stay also in wet swimsuits or wet undies. You always want to clean, a clean, dry swimsuit, or change your underwear whenever you are swimming, or just make sure that area is not going to be an area where the Candida infections are more liable to grow. So also, if you're stopping taking antibiotics for whatever reasons that you are prescribed for, make sure you take a probiotic to repopulate that digestive system or digestive tract with healthy bacteria or good bacteria. And here are some of the symptoms of Candida and yeast infections: arthritis, autism, chronic hives, fatigue, digestive disorders, muscle pain, short attention span, headaches, memory loss, vaginitis, skin problems, hyperactivity, depression, hypoglycemia, menstrual problems, urinary problems, respiratory problems, food and environmental allergies, and learning disorders. So Candida infections have different signs and symptoms, varies depending upon where the location of the infection is. And the infection is very common in women, and the signs and symptoms, as I mentioned before, is urination, burning in that area, irritation in that area, and that discharge. So it can also affect old people and young people like infants, where they grow thrush, a white thick patch on their tongue that appears on the inside of the mouth. And usually, oftentimes, they are immune compromised and cannot fight this Candida infection. So we're going to go into a little bit about the foods that are, something that you should not be eating or consuming. And cutting out sugar is very important. Cutting out rich foods of carbohydrates. Breads, I know everybody loves bread. Cheese and alcohol and milk and beer and any of those mixed alcoholic beverages. Those can really get your pH of your reproductive system out of whack and cause yeast infections to reoccur as well. So processed foods are also important to eliminate, as they have sugar, very high amounts of sugar, and yeast loving types of environments or foods. So some healthy options are coconut oil and probiotic, which I had mentioned, garlic, turmeric, bone broth, grass-fed beef, organic organ meats like liver. And because they contain vitamin A, vitamin D, and vitamin K2, which are really, really essential for the immune or to support the immune system. And I also want to mention kimchi, sauerkraut, kefir, and paw de arco. I'll put that in the description. It is an herb that you can take as a tincture or as a tea. And you can drink that daily to help keep yeast infections away or prevent one from reoccurring again. So you must pay close attention to your diet, because that's really, really important. Try cutting out and keep those foods, eliminate those foods. It's very important. And, if you suspect that you are suffering with Candida, you should first consult a primary care physician and before taking other steps. It's really important. Whether you've never been treated before for yeast infection, or you've had repeated infections, it's important to see your doctor first. There is no instant remedy for yeast infections. Most of the treatments normally take about 3 to 7 days to see some relief, and sometimes up to 4 weeks. So just know that know it's important to be aware of how to treat it naturally, and always important to know that get that advice from your healthcare provider. So I hope this was of use for you. Go ahead and subscribe to my YouTube channel, and also hit that bell, get notified every time I have a new video coming up. Thanks so much for listening, and I will catch you in the next video. Bye now, and have a blessed day. Bye now.